Hello, I'm Dr. Fiona Wu. I'm a consultant urologist at Urocare, and I would like to share with everyone on some common urological conditions and how we can better treat and manage them. Most of the time, the patients who come for a urological consult when the voiding dysfunction issues has severely affected their lifestyle as well as their work. For example, some patients may need to go toilet very regularly and in short intervals, so that will seriously impede their schoolwork or their work life. Another possibility is when they go to the toilet, they actually sit down there for a long time with very little urine coming out, or even after they have finished, they feel the urge to go again, or they feel that they haven't completed the whole voiding cycle. So as such, right, they usually will seek urological help. And I think it is warranted because we have to do a series of investigations so that we can help them better. And of course, there are some medical terms such as red flags that we use to describe certain situations, such as blood in the urine. When the patients pee, they actually find fresh blood or blood clots in the urine, or when they have a lot of pain when they pass urine. It can be something simple as dysuria, meaning that there's a burning sensation when they pee, or when they pee, they have this lower abdominal pain that actually severely disturbs the patient. When the patients have this kind of red flag symptoms, they should come and see a urologist because we have to rule out more serious conditions such as bladder stone, kidney stones, as well as some form of a tumor. So when patients come and see us for voiding dysfunction, there will be some simple tests that we can do first. For example, a urine culture and a urine analysis, whereby we check the urine for any possible infection as well as red blood cells or white blood cells. This is very important because if the voiding dysfunction is due to acute problems such as urinary tract infection, it can be easily managed and treated, and the patient will go back to normal as soon as we can. And of course, if the urine tests are quite clear, we may need to move on to other tests such as uroflowmetry and urodynamics. A uroflowmetry test is one whereby the patient goes to a special toilet, they actually void, and we can see the voiding pattern. We can see the speed of the urine, we can see the volume they voided and how much urine is left behind. We can even describe the way they void to see whether they have to push very hard, whether they need to strain, or they have a lot of leftover urine. So in all, this is a very simple and non-invasive test to measure the patient's uroflow. And if this is inadequate, then we have to move on to a more invasive test called urodynamic study, whereby we actually put in a urethra catheter into the bladder to measure the bladder volume and another small catheter to the rectum to measure the intra-abdominal pressure. In this way, we can see how the whole voiding cycle happens as the patient voids in front of us. This is a very good test because it can tell us which anatomy has the problem. For example, is the bladder weak, the sphincter too tight? This is very useful for us to diagnose and treat the patient. Sometimes the patient have other conditions which may warrant further investigations. For example, if there's blood in the urine, too much white blood cells, and it is not due to an infection, we may need to do tests like radiological investigations such as CT scans or ultrasounds. And occasionally, if the patient has a lot of pain or blood in the urine, we may need to do a cystoscopy, whereby we actually insert a small tube into the bladder to look at the bladder to make sure that there are no bladder stones or no growths inside the bladder. And of course, for the men, if the patient has obstructive symptoms such as difficulty in peeing, or they feel that it is stuck, or they have to wake up multiple times at night to void, then we may need to do additional tests such as prostate-specific antigen PSA, which helps us to diagnose prostate cancer as well. These are the usual tests that the urologist will do when they are faced with voiding dysfunction.